This is a paper I'd like to share with you. It's called Lyrical Truth, and this is about a paper I wrote in 2012 for a class assignment about Lyrica. Lyrica is Pregabalin. It's a Pfizer drug. And although a typical research paper is very cut and dry, sometimes illicit practices are uncovered. And I did not envision my paper taking this direction, but I found the data to be largely unsubstantiated and completely untrustworthy. Furthermore, I also suggested that Pfizer retract all the data they knew to be faked, as well as further their investigation post-haste into the side effects and true benefits, if any, that Lyrica offered versus other painkillers and epileptic medications, just to better evaluate this product for actual medicinal human use. This is my critical review of Pfizer's drug Pregabalin, better known as Lyrica. So this paper was written by me in 2012 for my university. Pregabalin was a fairly new drug to Pfizer, gaining approval by the FDA in 2005, and they applied for the first patent in December of 2003 through the New Jersey-based manufacturer Warner Lambert Company. From the time of its creation in India by Lakshbir Singh, 48 patients for the drug and various binding and chemical compounds have been patented in either India or the United States. Lyrica is approved for a dual analgesic and anticonvulsant purpose, and it's chemically altered slightly for each treatment. Symptoms including neuralgia, which is a family of vast encompassing disorders that results from numbness in the hands and feet, as well as pain and nerve damage. And then also there is neuropathies, which are including but not limited to mononeuropathy, which is nerve damage of one nerve, and then polyneuropathy, which involves multiple nerves, which is also frequent in diabetics. And then also that lesser known but very paralyzing Guillain-Barré syndrome, which is theorized to be more infection-based than generalized neuralgia or neuropathy. Anyway, it's also used as an anti-seizure medication for epileptics and a pain medication for post-herpetic neuralgia, and also it's used to treat some forms of anxiety. Now, I find that very ironic because one of the side effects is anxiety in the enantiomer compound over the racemic variation. So that is in regards to drug structures, which basically means that the anxiety presented more commonly when people took the drug that was not a mirror image compound. The one that was a drug structure involving a mirror image of both sides, that is racemic, that's the one that did not present as much anxiety. Prior to 2005, nothing existed to effectively treat nerve pain, as the relatively new ailments, fibromyalgia, and generalized rheumatism were very largely misunderstood. Lyrica was created to treat the pain associated with these generalized nerve pains in diabetics, neuralgia and neuropathy patients, as well as rheumatic arthritis patients, and for seizures as an anticonvulsant. Because fibromyalgia was fairly unknown until Lyrica was introduced, the widespread marketing by Pfizer also spread awareness for fibromyalgia, which in 2007 affected about 6 million Americans. And it is good to recognize pain and understand how to treat it. It was also partially bad because the industry essentially created a new illness in which people associated themselves with, and maybe they were perhaps suffering from something else instead. The vague and generalized nerve pain, the things that Lyrica treated could encompass multiple disease categories. So it was very difficult to pin down one specific person or ailment that Lyrica benefited over another. Amidst the praise for the need for an effective pain control medication, Lyrica did present some side effects. Most commonly were weight gain and tiredness. This, however, did not stop the world from loving Lyrica, as in the year 2012, Pfizer, which is the world's largest pharmaceutical company, reported quarterly sales of $395 million. That's quarterly, not annually. Quarterly sales of $395 million, making it the second highest seller, only to the cholesterol-lowering drug Lipitor, which quickly lost revenue because of all of the generics that became introduced onto the market. So as the trend continued, it was apparent that Lyrica would become the highest grossing pharmaceutical drug in the world by 2013. It should also be noted that Pfizer fought in court for misrepresentation charges over its drug Celebrex, and it handed over $164 million, which was pocket change to Pfizer, $164 million after 2 years of controversy over this arthritis drug in a class action lawsuit. But that wasn't the only controversy regarding misrepresentation of one of their drugs. So former chief researcher of acute pain, Scott Rubin, was dismissed for faking research in several studies. Multiple articles were pulled from medical journals as a result. He often cited his own incorrect data, only reinforcing his own false claims. Furthermore, 26 of his articles were either in question or completely retracted from the Wall Street Journal, and they were the ones that were reporting that among pain drugs involved in Rubin's falsifications, Lyrica was in fact one of them. But despite any negative impact these falsifications had on the findings of actual journals from real clinical trials, I wanted to look at Lyrica and just determine what these side effects were and if there were benefits, and did those benefits outweigh the costs of the side effects of this very common widespread drug. Pregabalin, hereafter known as Lyrica, is a Schedule 5 drug, so it's one of the least dangerous considered drugs. Ranging from 25 milligrams to 600 milligrams, the daily maximum dose is 600 milligrams. It's available in strawberry-flavored oral suspension, just to combat that bitter flavor, as well as being available in an encapsulated pill or an IV drip form. It can be taken with or without food, but it may render the drug less effective if it's taken on an empty stomach. So it's administered 2 or 3 times a day, depending on the individual prescription. The effects of the drug act to ease epileptic seizures and interrupt nerve pain. Now, people taking the drug should not discontinue use unless talking to their medical professional, because if you abruptly end taking this drug, it might trigger even more severe seizures in epileptics. Other severe but very common side effects include mood changes and suicidal thoughts, and physicians should monitor patients very closely. If caregivers notice changes in patients' moods, or if the patient is presenting something very different, then that is a huge red flag. Also, if the patient has a history of diabetes, kidney disorders, heart failure, or low platelets, then Lyrica should not be used because the side effects are very largely unknown. So side effects can also be severe and life-threatening, and people who also have severe allergic reactions to things in the past, they should not use Lyrica either, because severe breathing problems could happen. Renal function will be tested, and if it's found impaired, then the dosages could be adjusted accordingly. Also, women who become pregnant should absolutely not take the drug, nor should men taking Lyrica father children. Side effects on children are not known, and Lyrica was absolutely not for kids under 18. Findings were inconclusive, and at the time that I wrote this paper, Pfizer was actually studying and carefully monitoring women who became pregnant to understand the effects on their unborn children and better understand the full scope of birth defects. So this is not a full scope of side effects. There are a lot of other things that happened based on those individual people that experienced those symptoms. And this ranged from difficulty concentrating and thinking clearly, angioedema, which is swelling around the heart, rectal bleeding, and death. And these general studies, okay, there was a study that was performed by the National Institute of Health. Data was compiled among 10,000 controlled and non-controlled patients. So the whole group, 10,000, of whom 3,000 lasted 6 months and just under 1,500 lasted for 2 years. 42% of people reported tiredness and dizziness after taking Lyrica. And this is the main reason that if you're taking it, you should not drive or operate heavy machinery. Just don't do it. It's a very common side effect. Some other common side effects reported in 1 in 10 or 1 in 100 people, those include headache, fatigue, lethargy, insomnia, difficulty sleeping, problems with speech, memory and attention, irritability, confusion, shaky walk and tremor, constipation, vomiting, flatulence, dry mouth, excessive fluid retention, swelling in tissue, and cold or allergy-like symptoms. So we have very severe but common side effects. Now, there are also lesser experienced side effects found in 1 in 1,000 people, and they are including but not limited to rash or hives, shortness of breath, eye pain, visual disturbances, loss of appetite, low blood sugar and fainting, difficulty urinating or incontinence, panic attacks, mood swings, and hallucinations. That's enough to deter a lot of people from taking Lyrica, so they might just address their pain in other ways. But there are other rare cases of side effects which are found in roughly 1 in 10,000 people, and that includes kidney failure, pancreatitis, breast pain and discharge, bloody noses, painful periods or stopping of periods, and neutropenia. So this is a decreased white blood cell count. So it's not anemia, which is a decrease of your red blood cells. And the red blood cells are the oxygen transport. That's the hemoglobin. But the decrease of the white blood cells, we're talking about your own immune system and its ability to properly transport. And we also saw previously in the study that it also affects platelets. So with such side effects like this, I would very strongly recommend further research to be performed about these health impairments, and we need to have accurate accountability and a brand new foundation of this drug, because we didn't do it right in the first place and they lied about their results, and we're looking for a brand new baseline. So chemically, Lyrica, it's an off-white salt powder. It's an encapsulated potassium bromide catalyzing the conversion of an L-glutamic acid, or a GAD. And this does like 5 different things in your body, but it turns that L-glutamic acid into Gaba. And Gaba, remember, is the gamma-aminobutyric acid. It's an amino that travels through the central nervous system and binds to calcium channels on nerve cells in the brain and spinal cord. There's no evidence that Lyrica crosses the blood-brain barrier as an oral supplement, but relatively few studies have ever attempted to cover the issue. Now, the hyperarousal of GABA could be dangerous, but because of the flooding or reduction of GABA in the brain, it could cause seizures and other problems. But the role of Lyrica on GABA is to reduce the transmitters released in the central nervous system, which include that glutamate, the noradrenaline, and substance P. These highly active nerve channels are impaired by Lyrica, and it creates this calming effect on these neural pathways. But long-term effects are really unknown, mostly because no one had been on it long enough to really know the outcome of long-term or prolonged use. Lyrica should not be taken with other drugs, herbal or other, and to do so constitutes breaking the law. The chemical constituents are written as two different chemical compounds, and they are very similar, but there are slight shifts in atomic weights used in mixing this methyl with the aminobutanoic acid. And by affecting GAD in the central nervous system, the drug is processed through the body, and about 90% of it is expelled out into the urine. Although a few processes are offered for creating the drug, Lyrica is most successful in its therapy, really 40% more effective, when created with the S enantiomer GABA compound rather than the racemic Pregabalin, which means the first way the drug is manufactured for seizures is almost twice as effective as the drug created for neuropathy. However, in studies, although melting points of both racemic and enantiomer processes were similar, processing these melting points of 166 and 168 centigrade respectively, both drugs were unsubstantiated because first, no maximum chiral purity can be 100% when the statistical variations are within a means of 5% variance. And although both have 29 values and features, consisting of very similar atomically weighted compounds, both versions of Lyrica are chemically different slightly, giving them different melting points like we saw, but also different X-ray powder diffractions, which means they have a different crystalline structure. And perhaps most inconclusively disturbing, neither reports their moisture content. Yet both are reported to have an endothermic peak at 205 degrees centigrade. Now, prior studies were either inconclusively reported on or just altogether faked, making the most recent privatized trials of Lyrica the base comparisons for future studies to draw from. Additionally, those studies performed and released, well, the ones by Pfizer demonstrated numbers that were disproved in those privatized studies, which accounted for the 5% statistical variation. And they actually, those privatized studies, they determined that the moisture content was actually 3%. So from gathering more test results and basing them to these largely inconclusive ones that are not to be trusted, we can build a new baseline of understanding, but I don't think we should prescribe it until further investigation and trials can be performed. This is another one of those fast-tracked, big money things that they just lied their way through it, and humans remain the guinea pig. So there's really not a lot of transparency on this, but I do believe that, falsified data, Pfizer should receive more than a slap on the hand and a fine from the FDA. I don't think the company should have been allowed to manufacture the drug until all that inconclusive data was rewritten and once again re-verified. So that's what I have to say about this particular Pfizer release. And thank you so much for joining me.